innovative approach towards healthcare delivery, where we're saying that a doctor, for instance, in the US can oversee a medical procedure in Nigeria via technology. It can give instructions, it can tell what to do, and can even consult, a patient can consult a doctor in that way. So that's one of the innovative approaches that we've seen in healthcare delivery in recent time. Now, this saves time, and this gives access to people who perhaps would have needed to travel to the location of that expert to access his wealth of knowledge and expertise in that area. But with telemedicine, that gap, that distance was making to happen, that gap has been closed. So let's talk to Dr. Emeka Nwune, who is CEO of Swift Medics Healthcare, and see how much of telemedicine and other innovative approaches we're practicing in Nigeria in compliance with universal innovative approaches towards healthcare delivery. Good morning, doctor.
Oh, absolutely. Good morning. How are you doing?
I'm fine.
I'm
And
so
you?
glad to have me here. Amazing.
We're glad to have
So
you
good
here
to have
too.
you here this morning. Yeah.
Okay. All right. We want you to talk to us about innovative approaches in healthcare delivery universally. Can you talk to us about some of them and let's know where we are in those innovative approaches in Nigeria? I've mentioned telemedicine. Let's begin from there.
Okay. Regarding innovative ways of approaching healthcare delivery, I would say technology has really done a lot in facilitating that, especially through telemedicine and telehealth, through social media, spreading health awareness online, and the likes. So I would say technology has really facilitated that to improve, awareness, because first of all, we have to deal with a lot of barriers in our African cultural settings. When we talk about cultural beliefs, we talk about religious beliefs and the likes. So I would say technology and telemedicine has really helped, advance that. Currently, we're not there, but I would say we're in the process. I mean, there are a lot of new adaptations currently. We check out like the numbers of the way influencers are really doing great numbers with spreading comedy. So in the likes, a lot of people try to also spread health awareness, through the social media. I'm sure a lot of people are aware of someone called Apropos Doctor, who seamlessly does that constantly with social media. So I would say, first of all, the education gap is really, it's really wide currently. So right now, a lot of companies are trying to, create that awareness on the importance and, how technology has really advanced. Because if we decide to, continue using the old ways of approaching things, definitely people that are using technology will be way ahead of their time, and it will definitely make those other people in business obsolete. So I would say technology is here to stay, and we just have to figure out the best ways to tap into different forms of technologies and tailor it to our own ecosystem. Yeah. So I mean, like abroad and most Western countries have been adopting these processes like for a very long time, which we are slowly hopping on. And I'm sure like with time, more people will get used to it. And yeah, and I also wanted to just correct a little notion there. The goal of telemedicine and all of this is not to replace the traditional medicine, but just to, complement what is going on. Yeah, precisely.
Okay.
Hope
Thank you
that
for that
answers
opener.
that question.
Okay, thank you for that opener. One other development in the area of innovative approach to healthcare delivery is the use of mobile health apps. How much of that adoption goes on in Africa here, and how can we tailor it to the peculiar needs of our own health challenges as Africans? Mobile health apps.
Okay, mobile health apps have really helped, to track a lot of things, store data, especially like, for instance, women. women have their monthly their monthly periods. So there are apps that help you track your the flow to determine, safe periods and to determine when, the visitor is coming next. We also have like apps that help you track your fitness goals, like also like the external wearable devices like smartwatches, Apple Watches, and the likes. They help you track your fitness. They also help you check your pulse rates. They help you check your various vital signs, and these are all stored in your health records online somewhere. So health apps, apart from that, other health apps that help you, store information, help you track your fitness, help you track your diets, help you keep records of your health, where when you have your next appointment, you're able to, bring out everything stored together in one file, not that you have everything jumbled up in different pieces of papers or different books. So this really helps you know, organize your health information together. Apart from that, in recent times, apps that help you connect with a doctor from anywhere you are, 24 hours uninterrupted. Just like the way you pick up your phone and you order groceries online and all of that. That's the same way, like or order Uber. That's the same way, like lately you're able to seamlessly order or book a doctor to speak to a doctor. So most of these apps have made communication and access to medical services easier. Recently, I saw someone was trying to order an ambulance because of an emergency, and they had no access to that. But these days, I'm sure once you um, just certain apps that make access to this kind of services easy. You're able to easily just pick up your phone and order an ambulance or whatever medical services you need. And apart from that, it has really helped the challenge of private one-on-one consultations because, for instance, like I said, some of the cultural barriers we have in Nigeria has to do with like spouses, the wife having to submit to her husband and all of that, not having privacy. Sometimes, the wife and husband will go to the doctor's office together, and wife might not be so free to like express herself. But when you have that private one-on-one consultation, she knows that she's at home and she can, speak to her doctor privately and, say all the concerns she has. It creates that privacy, especially these days, even with the rising cost of fuel in our country. So it really eliminates all the stress of having to move from one place to the other and not being sure of the quality of service, because most of these telemedicine platforms that are registered are handled by licensed medical practitioners. So I also advise to make sure before patronizing anyone, make sure you do your own little research to confirm that they are all registered duly with licensed bodies, because that's very important. A lot of people on the internet, sometimes it's hard to verify, who is legit or not. There's a lot of people front where they're not. So it's good to do a little background check and make sure you're patronizing the right people. I would say, like I said, the idea of the whole system is to complement what already exists and not to replace. Like you said, a doctor can be in a foreign country and performing a procedure in a different country due to the strong internet, 5G access, and all of that. So I would say it's a combination of various factors, but I would say it keeps getting better, and we're open to harnessing this idea and maximizing it to our own advantage. Yeah.
All right, now let's take a look at e-health and the health information systems, the use of digital records and online platforms for healthcare management. I know that the Lagos State General Hospital makes use of that, but how much of that are we using nationally in terms for healthcare management, and how does it improve healthcare delivery?
Oh, yes. Trust me, the central data really helps a lot because in the old traditional ways, you have to, use papers and books, and sometimes those are exposed to various risks of destruction. They could get missing. a lot of issues are arising with that. But with the central data, it really helps with continuity of treatment, where if someone has their health records, even if they're going to another country, they could get treatment there where the doctor there requests this medical data. And thanks to new cybersecurity expertise lately that have helped, to encrypt this data and have them securely stored, with, various security codes to access them from the other end. Because this health information, if they leak, it can be very disastrous because they contain very personal information. So it's risky, but like I said, it's you have to do with the emerging new technology. There are also emerging ways where people are trying to hack your data and the likes, just to spoil your business. But so with the new innovative emerging ways of trying to hack, we also have engineers trying to develop ways of securing this data, and this data collaboratively, when properly collected and analyzed, it can actually help to determine future health trends, set new create researches and set new protocols for standardized treatments, standardized treatment protocols, which can be adopted by the government, individuals, private sectors, but in all to improve the health outcome. Because, for instance, if during a certain period, this is when this particular disease, or that it really helps track when epidemics happen, when pandemics happen. It helps track different trends and patterns in the healthcare industry. So this data is very, very important. Collecting data of your patients and storing in the cloud as well is very important. Like you mentioned earlier, we have a lot of facilities adopting that this new technology way. Sometimes I wouldn't lie. Sometimes it looks like it is slow, but I would say because of it's just something we're not used to, and I believe with time people get to adopt with this technology. Just like when mobile phones came into the country, it wasn't that easy. It was difficult for everyone to even have a SIM card, and it was quite expensive. If you can recall. But nowadays it's just easy. Everyone has a phone. Even a young child has a phone, tablet, access to internet. So I would say it's really evolving, and we're in Nigeria. We're picking on really fast, and I'm sure we're in the process, and we're heading there.
Okay.
Yeah.
Thank you for that. Now, you did mention the fact that data is very important, and diagnosis starts from data collection in a context. You get the vital signs, but then there is this talk of the reliability of some of these innovative approaches to gathering data for diagnosis. Let's take, for instance, the electronic sphygmomanometer that you people use to get blood pressure. I've seen cases where medical professionals, after having used these electronic forms of the sphig, still had to go back to the manual sphig because of what they call electronic inconsistencies. I'd like you to speak to it. To what extent can we rely on some of these new innovations in diagnosis?
All right. Yeah, it's very good you pointed that out. When we talk about wearable devices, we could talk about smart watches that have sensors. We talk about even your pulse oximeter that you put on your fingers when you're trying to get your oxygen saturation and your pulse in the hospital. We talk about different kind of even a blood pressure machine as well. So I would say different wearable devices have their own advantages. And for instance, your wristwatch cannot tell your blood pressure. So you wouldn't expect your wristwatch to check your blood pressure, but it can accurately, to an extent, check your pulse rate and your oxygen saturation. But regarding the accuracy, I'll leave that to the researchers, because they definitely carry out various studies to, and they use various sample sizes and various parameters to measure this research, before it's introduced to the market. And obviously, I'm sure, for instance, when they check your pulse with your wristwatch, they definitely check with, the pulse oximeter and check with other devices that can check at a way to, see the reasons. And for a fact, there could be false positive, and different kinds of errors regarding wearable devices. Because I know for a fact, when it comes to the pulse oximeter that we use on our fingers to check our pulse and oxygen saturation in the hospitals, sometimes, it's naturally made for people with lower melanin. That's like, I'm talking about people that are very complexion, white people. So sometimes there could be some errors with that. To be honest, like I said, it has to do with like scientific and different kind of reasons in lab, which I'm not really fully knowledgeable about. But I know there have to be protocols to introduce all of these devices into the market, and I'm sure researchers with time are doing their best to get better with that. Regarding the blood pressure, the automatic and the manual one, yeah, I understand what you mean, and to be honest, there could be other reasons that might not directly have to do with the machine reading. There could be reasons of, for instance, like the electronic blood pressure machines will need regular battery changes. They will need, certain, and even generally when you're checking your blood pressure, it needs like specific, there are certain rules, that you have to take while checking someone's blood pressure. So if there's any reason for a disparity in that, or is any of the protocols not fully, followed, there could be errors naturally. So you have to make sure like the person is not you can't check your blood pressure over your clothes. Like, it won't give you the proper reading. Like, the machine has to be like almost proportional to like the level of your heart. The batteries have to be changed regularly, and a lot more issues like that. So when these are not followed strictly, they can have errors. Yeah.
Okay, let's come to technology mainly now. Artificial intelligence, the use of robots for surgery, in assisting for surgery and other procedures. How far have we complied with that? And what are the issues if the compliance level is still very low?
Okay, so regarding robots and artificial intelligence, I would say, like, in general, we're still slowly adopting to the use of consulting with the doctor over the phone, and with the challenges of having to store data online, cybersecurity, and all of that. Regarding the artificial intelligence and robot assisted procedures, I wouldn't say we're there, but I would say there are a lot of investments in the health sector. A lot of healthcare startups have been raising funding to build that infrastructure. So even the use of chatbots to frequently answer health related questions, just like we're also adopting on our platform on Sweet Medics. So even when the customer service is absent, like the person is still able to ask health related questions and get answers to health related prompts. And the artificial intelligence, it continues to learn over time when people ask different questions, and when people contribute to the answers as well. So it kind of helps to pattern and analyze human behaviors, and in that way, it's able to predict some of these outcomes. So artificial intelligence, for sure, I don't see it as a competition with the natural or the traditional ways of we appreciate the medical field, whether it's telemedicine or in the traditional hospital setting. But I would say, because even after analyzing this data, the artificial intelligence gives a vague approach to it, while seeing the human brain to tailor it to a particular situation, to be more appropriate and useful. So yeah, so that's my opinion on that.
Thanks for staying tuned. It's still the discussion on health on early exchange. So we've been looking at the innovative approaches to healthcare management globally, and specifically also talked about how far Nigeria has moved in terms of innovative practices. But right now, let's look at some of the barriers to healthcare access in Nigeria as we continue the discussion with Dr. Nwune Emeka, who is the CEO of Swift Medics Healthcare. All right, doctor, let's look at some barriers that hinder access to healthcare delivery. We know that a range of them, there are very many. Can we have some of them? Please, can you unmute yourself?
Oh yeah, sorry about that.
Okay,
So
let's look at the barriers now.
Okay, I'll say first of all, availability of quality health infrastructure. You know, availability of quality doctors, because there's a lot of doctors are traveling abroad to look for more lucrative sources of income, as well as even doctors, trying to diversify to more specialized practices. Also, I would say, funding. Sometimes, it's not these days, like, the economy hasn't been the best, so people are even struggling to eat. Talk less about take care of their health or take their health as priority. Now, I would also say education gap, because early education, health education from primary schools to religious institutions to public places to government places, it's very important. Even social media, it doesn't have to just take the influencers. It also boils down to people that care about their health, making sure they share the right information on social media. So people are just quick to, send a broadcast message without even reading through. So it's very important to read through and make sure you're spreading the right information. So yeah, those are a few of the challenges regarding, the rising incidence of non-communicable diseases in younger generation. Before we used to think that you have to get to a certain age before you're hypertensive or have certain health conditions, but nowadays we notice like even younger people are coming down with such problems. Yeah, I think up the top, these are just a few of the challenges when it comes to the healthcare infrastructure. I would say also funding, access to quality healthcare, language barriers, cultural beliefs, because certain cultural religious beliefs, limit you to receiving certain type of medical treatments.
Okay. Now, you as
Yeah.
the CEO of Swift Medics, if I take the literal meaning of the word Swift, it means healthcare has to be accessible almost at the speed of, tapping the finger, if I got that right. But then we know that in some parts of Africa, geography is a problem, talking about rural areas, and that could, limit the access to quality health services. How can we, thank God we started with the place of innovation in healthcare delivery, how can technology essentially break the barrier of geography and give us swift access to, quality healthcare?
Okay, to be honest, healthcare is, no matter how much you want to tone it down, healthcare has to bear a cost. Healthcare cannot completely be free. But the idea of universal access to healthcare just means, not having to break your bank to access healthcare, means, having access to healthcare whenever you need it. So, to be honest, in those remote areas, they still need some kind of, funding in those regards, because when we talk about the health practitioners, they can do as much as, doing community outreaches and, partnering, because it has to do with a lot of collaborations from the government to non-governmental organizations to private individuals and just people that care, stakeholders, family members of people affected. You really has to do with that collaborative effort. And, like I said, community outreaches where, health practitioners go into communities that are underserved, and they are able to, provide healthcare for these people at least at no cost. But like I said, it still has to do with funding, because those health practitioners have to be compensated. The materials used have to be catered for. So it also takes like um, companies, organizations that are interested in community social responsibility initiatives to also implement that, because I know most big companies these days have those arms that take care of those aspects. And when it comes to the very remote areas in regards to telemedicine, they might not have access to internet to access medical care, just like like most telemedicine or telehealth platforms. And these days, I would say there have been new approaches to accessing healthcare from even places you don't have internet. With collaboration with telecommunication companies to create USSD codes where people that if they don't have smartphones, they're able to still access healthcare. And also, like you're mentioning earlier about wearable devices and remote medical procedures where a less skilled medical practitioner can be in a field and still have this beneficiaries access healthcare from anywhere. With the professionals can even be far away, and they still have access to medical care through technology and through telemedicine. So it really takes a collaborative effort and takes stakeholders, to identify these issues and, tailor it to communities, depending on the goal. I know for a fact, like in certain places in Nigeria have limitations to healthcare services because of so many factors. So I would say it just really has to do with being tailored to what the needs and requirements of that community has to be. Yeah.
Okay, let's talk more on preventive medicine, vaccination programs, campaigns, and maybe sensitization to increase people's awareness of certain diseases that's overburdening the healthcare system. What is the way to go about that?
Preventive health, definitely. To me, I preach and advocate for preventive health because I believe, prevention is better than cure. And when we talk about preventive health, we're talking about, ways that we can prevent these diseases from occurring in the first place. We're talking about ways that we can, prepare our bodies to fight for, ahead of these problems. We're talking about ways that we can boost our immunity and our immune system to fight for us. We're talking about ways that we can nourish our body, talking about ways that we can, improve our lifestyle, because lately, everyone a lot of people, get carried away from what they see on the internet. They see a lot of people, abuse alcohol, abuse cigarette smoking, and a lot of substance abuse, which have adverse effects on our health, when over a period of time. And, when we think about all these things, we think about ways that we can detox from these problems. We think of ways that we can, reduce or even completely stop these habits. We think about exercising and being active, because exercising can greatly help you prevent a lot of these problems. We're thinking about ways that, people can, because no matter what, stress will definitely come. We have to make money and we have to move around, especially in Lagos. So we have to just figure out ways to cope with this stress, to prevent it from having detrimental effect on us, like, even down to mental health problems, down to causing hypertension and various stress-related, even sleep disorders, just ways that we can, really cope with these problems ahead of it now being like there and we're trying to solve the problem. So preventive medicine just approaches ways that, we can prepare to greatly fight these problems even before they come on. So I'd say, what we eat, we have to consider what we put in our mouth, make sure we have, stay rehydrated, drink a lot of water regularly, eat a lot of fruits and vegetables, reduce processed foods, reduce fast foods, reduce oils, just various things that we feel that are harmful to us. Like, a lot of people don't know what's harmful. So if I say things that will feel that harmful, that might not be the right way to go about it. But we just need to eat more healthy and take care of our health more. Yeah, and we need to spread the right information. Tell our neighbors, our family and friends the right thing to do when we have this information, because we can't just keep it to ourselves. If you're protecting yourself, it's good enough, but when you spread the information, you might be saving a lot of lives. So it's very important that we prepare our bodies to prevent these problems even before they exist.
All right.
Yeah.
Now, when you talk about, educating the masses on what is good for them and what they should or shouldn't put into their mouth, with respect to, health procedures, one key barrier to assimilation of these new ideas is cultural insensitivity on the part of some of those who are into orthodox medicine. There is this friction with, traditional medical practitioners who believe that before you people came on board, they had their own things working for them, and this can be a barrier. How should, orthodox medical practice treat the tradomedical counterpart in such a way that will respect the cultural positions of them and limit, friction to our entry? How should they collaborate?
Okay, so
or what can they do together?
So to get you right, did you say medical?
Yes, we know that we have the traditional medical practitioners in their own climes, in their own rural areas in particular, and then you want to do the norm, introduce them to new ways of doing things, and you experience some kind of barrier because of that cultural sensitivity. How can we still respect their culture, at the same time introduce the new ideas that we have brought to them without creating barrier for ourselves? That's the question I'm asking.
Okay, that's a very, very valid question. I would say it really takes collaboration, and it's quite technical, because whether we like it or not, these people exist. Like we said, we have the limitation of access to funds. So if people feel like they cannot afford healthcare in the hospital, though, to be honest, most people go to this traditional healers and community workers. That is why, like I said earlier, it takes collaboration between various stakeholders. We're not just talking about the doctors in the hospital. We're talking about just other people. So it just really takes collaboration, honestly, because sometimes even before they come to the hospital, maybe they might have gone to a few other places before getting to the hospital. So it's very important where there's that collaboration and understanding in the way we approach things, and that is why it's very important for any field to have standard of operations, where we have protocols of treatment and standards and guidelines that are strictly followed. So in that regard, and apart from that, when we talk about the cultural beliefs, for instance, there's some cultural or religious beliefs that we just can't eliminate, but I think with time we can just continue to emphasize the importance, because, for instance, some particular religious aspects or sects don't believe that you are meant to receive blood. Talking about blood transfusion, and we know that blood transfusion can greatly improve one's lives, like when needed. So those kind of barriers, even in case of emergencies, can really pose restrictions and limitations. So it just really takes we overseeing or overlooking barriers and coming together to collaborate, having these discussions, having workshops and seminars where various stakeholders and healthcare individuals can come together, have conferences, after that network, and it also takes like governments to, implement these policies,
All
and
right.
everyone's seen how we can greatly benefit.
All right,
from
thank you
them.
very much,
Yeah.
Dr. Emeka Nwune. But I also know that sometimes it's about ego. Maybe in cases where some traditional practitioners have been able to, with their own medicine, attend to some health issues, maybe even cure them. So it now becomes a thing of, oh, we've handled this in the past, so there's nothing new that the orthodox medicine wants to bring aboard. But it should be about the best way, the most efficient way to save lives, and not really about ego. So collaboration really is needed in that area. Thank you for staying with us, Dr. Emeka Nwune.
Thank you so much. Thank you so much.
All right. A while ago, when you were mentioning the barriers to healthcare access in Nigeria, you talked about availability of doctors. Now, in some other climes, they've introduced a kind of method where they have paramedics who stand in for cases that you don't necessarily need a doctor, or maybe for emergency cases before the patient is taken to see a doctor. Can we have more of that in Nigeria, maybe even in local areas, some people trained to stand the gap?
Well, yes, I would say, I think, for as far back as I remember, that has been, to be honest, happening. But I would say maybe not really consciously considered, because like since primary school, I've been seeing Red Cross, I've been seeing a lot of, Red Cross related organizations that are organized and, create these trainings. And I see a lot of HSC, Health and Safety of the Environment companies as well, that provide those services where they train, even companies get those kind of trainings where they are trained on, basic life support and basic emergency, basic ways of attending to emergencies. They train staff and certain people, they train everyone, and they, especially train certain staff to help curb those kind of events in events of emergency. So those kind of trainings really help in controlling that aspect. Yeah, I'll say.
All right. Now, let me just
I
ask
can't
if
really
there
remember
is.
the second part of the question.
Okay. Let me ask, in the legal profession, for those who can't afford, legal charges, we have the legal aid coming to their rescue. Do we have some kind of volunteer medical service rendering in this part of the world? Because that could go a long way in, addressing the challenge of barrier to quality healthcare delivery. I know that healthcare is very expensive, but do we have some kind of social interface, volunteerism in the healthcare sector, just as we have in the legal sector?
Honestly, we have no organized way of, of that in the medical sector. It's not official, but some hospitals, create those kind of policies to help patients. Because I know there's one of the hospitals I worked in the past. I think it was in 2021. They had that kind of policy where, because obviously when people come to emergency, yeah, naturally they're meant to, make a deposit of certain amount of money. But, there could be different barriers to making that deposit. Maybe the family member is not reachable at that time, or whatever case it might be. So the hospital came up with a policy where when anyone comes to the hospital and, it looks like, okay, they can afford the services, but they cannot afford it at that time, but they're still trying to, make, go through the process and, get access to funds or whatnot. So they made a rule that, okay, you could start, with an emergency treatment and just try to stabilize the person in case of that emergency, where you could use up to about 10,000 naira worth of materials. But once it's exhausted, it's there's nothing we really can do, because it's a private hospital, and that helped because at the end of the day, whether the person ends up paying the money or not, it's the hospital's loss. So the hospital just use that as a way of supporting the community, which I wouldn't say is the same for a lot of hospitals. So it really just has to do with, those kind of situations. And apart from that, non-governmental organizations have really greatly helped with, helping people settle their medical bills in hospital and raising funds for people that, need to perform high cost medical procedures. So non-governmental organizations, just private people that really care about helping other people have also, really done a lot regarding that. And apart from that, there are also other private medical startups that provide loans and access to funds for people that need them. For people that have jobs that need those funds for healthcare. But those ones still obviously they still have to pay back, so it's like a loan to healthcare. But apart from this, the best of my knowledge, these are just a few areas I'm aware of that people access funds to healthcare.
Okay, let's look at partnerships. In what way would partnerships with global health institutions and organizations help with issues like funding, even supply of some medical equipment, drugs as well?
So the collaborations with global organizations have really done a lot. There are a lot of global organizations that I make my research and I see what they're doing, and it's really commendable. A lot of organizations, especially people that are faced with chronic conditions, viral infections like HIV, hepatitis, tuberculosis, sickle cell. Some organizations help provide free drugs, free treatments, free medical clinics, even some kind of insurance cover for some of these people. So I'd say those kind of funds and this kind of support have really done greatly, especially for underserved communities. Like I mentioned earlier, with the economic situation of the country, a lot of people are not even able to, feed properly, talk less about buy medications for their health. It's not easy to advocate to people the importance of, trying to be proactive towards their health. By the end of the day, it still has to do with one knowing the importance of taking care of your health and these people, because these people coming to aid them, because like I said, the people affected, they really don't, it's not like they don't care, or they just have more importance or more their pain points are different at this time to compare it with the healthcare system. So it just really takes people that care for them to help. Someone reached out to me, so someone that had a broken leg got hit by a truck like 2 years ago. And she reached out to me and she's like, oh, please, how can we help this guy? Please, how can we, help him probably access a surgeon and all of that? We've been on that case for a while, but that guy has been on that street for a long time and no one really cared about, trying to help that person. So like I said, it just really takes people that want to do it. You can't really force anybody. You tell someone, oh, let's try and do this for healthcare, let's try and do this. They'll tell you, man, they've not eaten. They'll tell you their own pain points. So it just really has to do with like people that are moved by it and people that really care, in all honesty.
Thank you very much, Dr. Emeka Nwune, the CEO, Swift Medics Healthcare, for being with us on Early Exchange, talking about healthcare access and universal coverage. We've looked at the innovative approaches to healthcare management. We've also looked at the barriers to accessing healthcare in Nigeria. We value your time with us today on the show.
Thank you so much for having me.